everyone. I'm Dr. Jeff Trinkle, the CEO of the Los Angeles Center for Ear, Nose, Throat, and Allergy. For the last month or so, since the lockdown, we've been doing a lot of COVID-19 testing and consultations. I've been growing very familiar with what's happening. And over the last 3 weeks, we've been doing a lot of antibody testing using a company called Vibrant America, which we have found to be our favorite so far, as they give what we think are the most thorough results and also have the lowest false negative rate. Every time we do an antibody consult, we get asked pretty much the same questions. So I wanted to answer them here in a forum because I think that it will be helpful for not just the people we've already consulted, but people that may want consults in the future, et cetera. And those of you who are wondering, when is a test legitimate? We see a lot of news articles talking about fake testing. We also see a lot of articles about tests that are not as accurate. And those are the questions we're getting asked every single day. So today we're going to go over all of those things, as well as do an antibody test here on camera. Now, the antibody test we're going to do is not FDA approved, and I wanted to do it this way so you could see what kind of results you're getting from these types of tests. So this is a Chinese company called Deep Blue, and these have been out there kind of all over the place. We've seen a lot of them because they're able to sell to anyone because they're not FDA approved. That's the first step in identifying whether or not a test is, legitimate, so to speak. And the reason why is because here in the United States, until the FDA and the CDC have a good grasp on how to utilize these tests, they don't want everyone just taking them and then thinking that they're immune. So the FDA has put a very large ban on companies even being able to sell their finger stick devices or other devices. And the only way you can obtain one is if you are a highly complex lab. There are different certifications for labs, meaning your doctor's office can draw your blood, and a lot of times they can even run urine tests, et cetera, especially OBGYNs, a lot of urologists, et cetera, even family practitioners. They usually have what's called a CLIA waiver. A waiver allows you to do a small list of different things, including a lot of finger pricks, such as a blood glucose reading. Even though there are some FDA-approved companies that allow for a finger stick device, they are not allowed to sell to a doctor or an urgent care or anyone unless they have a CLIA certification for a highly complex laboratory. That means a lab that can perform a lot of different readings. There are lots of private labs. Hospitals have these labs. Quest, LabCorp, et cetera, are all highly complex labs. So if you're getting a test that in an urgent care or a doctor's office where they're doing the test right in front of you, or they're touting, 10-minute results, it's not a real test. There are a lot of urgent cares drawing blood and sending out. That is completely legitimate, but I would still try and find out where they're sending to. It may just be Quest, et cetera, but we'll go through that. So let's go through this so that you can see what this is like. So these come in these small kits, and this is where we think that we'll be in, let's say, a month or 2 months, probably longer, maybe more like 3, once the FDA has a better grasp on how to utilize this data, and we can inform patients and not have them doing this themselves, because what you do with these results is as important as getting the results themselves. So inside these finger stick devices, or these kits, is this, which looks like a small pregnancy test, and a small pipette. The way we do this, obviously clean off the finger. This is a small lancet I use to check blood glucose and ketones. Yep, I'm that guy. Get a small amount of blood going. So you want about 10 microliters is what it says. Draw it up in a pipette. I'm dropping the blood into the specimen cup, or specimen area. Need a little bit more. So once I've filled this little area up, which you can't really see, I'm sorry, but I've filled up this little area with blood. There's a buffer. And I just place 1 drop into it, which I placed into there as well. And then we wait 10 minutes. So I'm seeing it fill up right now. I'll be able to see there's some filling going on. Perfect. So I'll watch that and make sure that it makes it all the way to the control line. And we're going to wait. It takes about 10 minutes to get results. Excited to find out what mine show. So while we're waiting, I figure we can talk about the different types of testing. So I like to categorize for my patients testing, when we're talking about legitimacy of testing, into kind of three buckets. One is completely illegitimate. The second two are legitimate tests, meaning they've been validated or reviewed by the FDA. They have to be usually born here or have a company here in the US. And one of those is less specific, meaning there's a higher false negative rate, and the other is more specific, meaning has a lower false negative rate, so better specificity. So it's very interesting. So let's start with the illegitimate ones first. So things like the one I just did, I would consider to be, quote unquote illegitimate because not because they don't work, but because you don't know if they work or not. For all we know, this type of kit coming from China being sold by a completely separate vendor could be completely falsified or made up. You even heard stories of temperature guns coming in where they always read 37.7 Celsius, 37.7 Celsius, and then all of a sudden they opened it up, there's nothing inside. This could be a pregnancy test that I'm just dropping blood on and it's always going to show negative. We don't really know that, and there's no way to control the knowledge of that unless it's been governed by our federal government. Not to say that our federal government is the best or knows all, but until we have that data, we just can't determine the legitimacy of a test. So if it's being done by just a regular practitioner, by someone on the street, by a small business that's trying to sell you on, we have cheap antibody testing, or we can do it for $49 or whatever that is, and they don't have a complex certification in their lab when they're not drawing blood or sending it out, you can rest assured it's probably not legitimate. And I probably wouldn't vouch for those results. Not to mention, you don't know if that person knows how to read those results. So every situation is different, but I would say it's a pretty easy bucket to say, if it's not being done at a highly complex lab, then it's probably not a good idea to use it because there are other options out there. Second, our two buckets are legitimate, both legitimate. So when I say legitimate, this is what I mean. There's a lot of labs that have come up with very good testing platforms, and all of them have been reviewed by the FDA. What that means is they did their testing, they showed a decent sized cohort, usually about 300 people, and they sent all of that information to the FDA. The FDA then sent back and said, we reviewed your data, we feel like it is valid, and you can go from there. That's not an FDA approval. There's no antibody testing in this country that has an FDA approval for diagnosis. And that's what we're really looking for diagnosis, okay? So that may seem contradictory because you have seen many labs saying we have FDA approved antibody testing. What that means is that they have an FDA approved device, okay? So let's talk about what that is. Any lab in America that gets validated can test you for antibodies without an FDA approval. What they're saying is that we can show the antibodies exist, but the FDA won't approve it until you can use it for diagnosis, meaning once they have enough data to say, you have done this blood test and it shows you have antibodies, and so we know for sure you had SARS-CoV-2 or you currently have SARS-CoV-2. Until they can prove that, they're not going to get an FDA approval. So that will probably take at least 3 to 6 months, I would imagine, but I'm kind of guessing there just because of data. Data is very sparse, and we have to compare it to what's called PCR testing. That's like nasal swab, checking for viral DNA. Until you can show over thousands of times that at the same time as a PCR test, yours showed IgM positive over and over and over, the FDA is not going to approve the test as for diagnosis. That being said, there is a way to get an FDA approval for your antibody testing, and lots of them have done this. You've seen SELEX, Abbott, ChemBio. All these companies have an antibody test that is FDA approved or has an EUA, which is essentially the same thing right now. What they've done is they've shown that they draw blood and they get your antibody results. And they've shown that through, a couple hundred patients, and the FDA has approved it and validated it, said this is good. Then they said, hey, we think we can do this faster and cheaper so that it's more accessible to patients, which is fantastic. So they then take a finger stick device or a rapid test, for instance, something that's faster than 3 to 4 days, and they validate that against their current standard, which is serum or blood draw. So they show, hey, every time we did a blood draw, we got these results. Every time we did a finger stick and gave a 10-minute reading or 30-minute reading, we got these results. And they match, they're the same. So the FDA goes, hey, your blood draw and your finger stick are identical or very close. So you are approved to use a finger stick device or to use a rapid device. So the FDA approval is for the rapid device, not necessarily for the blood draw. Now, the tricky part is most people don't understand that. So when they get a huge New York Times article or LA Times article that says FDA approval on the head for SELEX gets FDA approval for antibody testing, everyone thinks, boom, we have an FDA approved antibody test. It's not the case. You don't have an FDA approved antibody test. You have an antibody result or approval for the way in which you're getting it. There's value to that for sure. But as you'll see in a few minutes, it doesn't mean that the test is better. Because they have an FDA approval or an EUA, it doesn't make their test better than another one. It makes it validated by the FDA for that specific device. I hope that kind of makes sense. So now let's kind of get into the weeds a little more about why we use Vibrant. So Vibrant actually is just releasing a paper where they have over 7,700 patients nationwide and have shown their sensitivity and specificity for all their antibodies to be very high, both above 98%, which is really, really exciting. But more exciting than that is kind of where they're going with it and also the transparency of the company. So we have actually called multiple companies and I have tried to get on the phone with the laboratories to find out what are they exactly testing? What is the surface protein, which we'll get into in a second? What lab are they, not what lab are they using, but what device are they using? Because a lab itself is just an entity that uses a device. The device is what has the validation from the FDA. So for instance, LabCorp and Quest. You should call them and find out what they're using because you want to know what antibody test am I getting? I'm getting a Quest antibody test. Quest does not own an antibody test. They own a machine. We presume they're using Roche, which is on the FDA approval list or the validation list. But we don't know that because I've called them many times, been on hold for hours, and I can't find that answer anywhere. So there are other private labs that are doing it or other urgent cares that are sending them out. We're just not sure what they're using exactly, which is fine as long as they're using something approved. But if you don't know what that is, you don't really know what they're measuring, okay? And what I mean by what they're measuring is this. There are multiple surface proteins on the top of a coronavirus that make coronaviruses unique, okay? This right here is just a quick broad overview of these different surface proteins. So spike protein is one of the proteins that we look at the most when it comes to coronavirus in general. And so we're trying to find whether or not antibodies are attaching to these proteins. What an antibody is, to get a little bit farther back, this is a really quick photo that helps me explain to patients what an antibody is. So imagine this is your virus, and on the surface of the virus are these little proteins. These proteins are what make the virus unique. So spike proteins in particular are a protein on the top of a coronavirus that are what helps it attach to respiratory epithelium and makes it so dangerous in the lungs, which is what causes the main problem. These spike proteins underneath a microscope also make the virus look like a crown, which is why it's called the coronavirus. So what we do is we look for these very specific proteins that are unique to this virus itself. We then check to see if an antibody, which looks like this, which is formed in your blood, it's formed in your lymphatic system as well as your spleen and your bone marrow. This is your kind of secondary immunity, so to speak. So what I mean by that is when you get sick or a regular cold, whether it's coronavirus or other virus, you have an immediate response by your body to send a bunch of cells to try and kill that virus. If it's lasting longer or sometimes even immediately, your body will start to create antibodies. These antibodies come help. They're the secondary line of defense. They come and they help the normal cells to just destroy the virus itself, okay? So these antibodies, which are these little Y-shaped things, they require something to latch onto. They love latching onto these surface proteins. So that's what we're testing for. We're seeing how they land on these surface proteins, okay? So this becomes important in a second, but I do want to explain what antibodies are. So to go back even farther to explain more about what antibodies are, an antibody is something that your body forms to help you gain immunity because it can last a long time. Meaning, once an antibody is formed, specifically IgG antibodies, they stay dormant in your bloodstream, doing nothing except waiting around for this to exist. So think vaccines. Think of things like measles. Okay, when you were a kid, you got a measles vaccine, I hope, and so you have these IgG antibodies sitting in your bloodstream waiting for someone to infect you with measles. So now you go to Disneyland and someone came from, say, another country and they carried with them measles, and the measles virus got into your body and your antibodies destroyed it immediately. You never had any problems. Versus someone who did not get the vaccine may not have those antibodies formed, or probably won't, and they could be at Disneyland and get infected and have measles. Now that's why you see measles outbreaks happening at times for unvaccinated people. So without a vaccine, our bodies can still form antibodies, and they do this all the time for different viruses as well as influenza. The reason influenza is so hard to vaccinate for is because it rapidly mutates. So now fast forward, let's get back to SARS-CoV-2. What we're looking for are these antibodies because we want to know, have we been exposed in the past? Are we exposed right now? And do we have antibodies forming, specifically IgG or chronic or long-term antibodies, to help us fight this off in the future so that we don't get infected a second time? So kind of back to the test that I did earlier, or I'm still kind of waiting on results. It's 10 to 15 minutes. I'll kind of show you what it shows me. So this right here, see that red line? That's the control. So that tells me that the test worked, meaning the control is positive, and the control is SARS-CoV-2 in rabbit plasma. That's what that buffer was. So now I'm waiting to see if the IgM or the IgG light up, okay? And if I get a line in either one of those, it's a positive test. So I think we've been about 5 to 7 minutes now, and I have nothing there. So we'll still wait another 5 to 7 minutes. So this is kind of what you're getting when you do these other types of tests, okay? You're getting yes or no. It doesn't really tell you much information. It just says yes or no. So back to those surface proteins that we were talking about before. Here's an example of what you get through the company we're using. So this is a real result from somebody. And these are the 4 different surface proteins. And these are the 3 antibodies that they're testing against currently, okay? IgM and IgG are the most common. So think of these as 4 different tests. Now, why do they do 4 different tests and other people do 1? Well, that's a very interesting question, and one we get asked a lot. And the reason why they can do this is because they have a proprietary technology at their laboratory that they've been using already for things like Ebola and Zika for many years. And all of those have been validated by the FDA, approved by the FDA, et cetera. So when this all struck, they immediately moved their assays and started doing things for SARS-CoV-2. The reason they're able to do so much at once is their proprietary technology allows them to use these microchips where they put the assays into a waffled microchip and they can test multiple different assays at once. That makes them able to run a lot of tests concurrently and quickly versus other companies can only do 1 at a time. So let's take this example of this test. I don't know what they're checking for. It could be nothing. But let's assume that they're doing the spike protein S1, okay? So if they're only testing spike protein S1, this test, if it came back positive, would be fine because their IgG would have shown positive and their IgM negative, and it would have been no different than the test that we're using through Vibrant. However, if you're using another company, and I'm going to make this up, but let's say you're using a private lab and they're using one of the validated and approved devices, and they check for receptor binding domain, okay? And that's all they check for. Well, guess what? This would have been negative, and it would have told the patient that they have no antibodies formed, they've never been exposed, etc. That's incorrect because they have been exposed, but they only form antibodies to the spike protein S1 and the spike protein S2. Same thing goes for nucleoprotein. I think you guys get it. If you use other companies, you don't get the full 4 antigen assay. So you're only seeing about half of what is out there, all right? Now, if all 4 of these lit up, then it wouldn't really matter where you went, and a positive's a positive. So we're not concerned with the positives and the accuracy of other companies with the positives. We're concerned with their negatives and whether or not they actually have negatives. So now let's fast forward to what Vibrant is going to be doing in the future, which I think is the most exciting part of this, okay? This is where we think that being able to use antibodies in the future is really going to go, all right? So what you just saw and what you're seeing with these cheaper tests is what's called a qualitative assay. Qualitative just means yes or no. Do you have it or don't you? And there's a lot of value to that, especially in simplicity and when we're trying to do things at rapid scale and quickly. Okay. But if we're trying to get businesses back to work and we're really trying to use these assays, what we want to see is trending. And also, if we're working on vaccinations, we want to know how long does IgG really stay in your body? Okay. So what we need is something called a quantitative assay. The reason why you don't see this readily available right now is what is quantitative? What are the reference ranges for positive, for negative, for high, for low, for moderate? There's no way to know that information from such a small sample size of people. So what we are moving towards in the future is these quantitative assays. So remember, green is normal or was negative on the other one, and red was positive. Okay. So now they're adding something called moderate. So what they're doing is they're trying to give you an idea of where you currently are. So this is a patient that they had, but they use as an example. And they have previous versus current. So this person has been tested twice. So if you look at their previous, they took out the IgA antibodies, you'll see, because they couldn't find the best direction of how to take that. So if you take this patient as an example, if you look at their previous, they were IgM positive at 1.2. IgM is an antibody that starts usually about day 3, detectable around day 5, and it starts to decline after about 2 weeks or so. That's helpful because it can give us some insight into the window of antibody testing or of antibodies and infection time. Okay. IgG is something that usually starts more in the 2-week range and then kind of elevates and then levels off, and it can taper down, but usually it does stay up higher. Okay. So this patient had IgG previously at 1.4 and 1.5 and IgM at 1.2 and negative, negative, negative. So you can see that this person, if they had had any test that didn't test for spike protein S2, all this is negative, right? If you understand what I just said, you can see how dangerous those tests can be because IgM means you are contagious. You are in an infectious stage, likely, not 100%, but likely. So this patient that had IgM positive needed to get PCR testing to know that, for diagnostic purposes. But if this patient was, let's say, going to have a procedure, dental uh, dental procedure, having their wisdom teeth taken out, a cleaning, etc., they may have been completely asymptomatic, but been contagious and gotten an entire office of people sick. They could have gone into a doctor's office. They could have gone to a restaurant to eat. Had they known this, they would have quarantined immediately. Okay. And so you can start to see there's some utility in using these antibody tests. So luckily, they didn't go to another company. They did do theirs with Vibrant. So they knew they were at 1.2. So now fast forward a week later, they repeat this test and they see this. Okay, IgM is starting to drop. That gives us some insight. They may still be contagious, but it's starting to go down. IgG stayed equal for spike protein S1, but really disintegrated for S2. So what that tells you is that just like many of the other coronaviruses, this coronavirus, SARS-CoV-2, may actually not allow for antibody formation to stay in our systems as long as we think. That's really important info. And maybe it does for some and it doesn't for others. But unless you have a really comprehensive quantitative panel, you really can't know that information. So what do we want? Ideal situation. Everybody in America got a blood test once a week and knew all of this information on a weekly basis. That would be perfect. The problem is way too expensive, still not covered by insurance, still don't really know what to do with the information. Okay. So it's a kind of a hard problem that we're up against right now. But the only way to get there is by doing more of this. So that's great. Everyone wishes we could be there, but we can't. So what can we do with these results right now? Well, what we're doing currently is working with a lot of small businesses to try to find a way to utilize the results we have now to get everyone back to work as safely as we can. We can't stay hunkered down forever. We all know that. But the answer isn't to just rush back and go back to work and just be all full force. Because if we do that, as you can see, there's going to be a lot of people with a test just like this that were IgM positive and asymptomatic. They didn't get their PCR test. Why would they? Maybe that would have even come back negative because they don't have enough viral DNA shedding in their nose, or the test wasn't good, or whatever it is. So what we need to do is find a way to utilize what we currently have to help to generate our economy back on track. That's kind of what our practice is doing currently. Along with our local testing, we are trying to reach out to small businesses, large businesses, to find a way to utilize the data that we have at our disposal. Okay. On top of that, this kind of hopefully explains to all of you guys why it's important to understand what type of testing you're getting, so that you're not using a test that shows you this and isn't helpful. As you can see, it's completely negative. Not to say that that's wrong, because it could be right. My antibody test environment was also negative. But if you thought you had an exposure, doing something like this is not going to really give you as much of the results as you want. Unfortunately, the tests are more expensive because they're doing so many different ones at once. But at the end of the day, what you're really looking for is accuracy. The last thing you want to do is go and spend money. I believe Quest is at about $100. You go spend $100, it's negative, and you just sit there to yourself, am I really negative? So you call, you can't get in touch with people, etc. That's a really tough problem. Anyway, I hope that that was a very informative video, and it kind of answered a lot of the questions. This is what our consultations generally entail. Not quite to this extent. I don't prick my finger and show me doing a test every time, but I like to explain this to people in a face-to-face manner and answer your direct questions. That's kind of what we offer at our center, is that we are run by physicians who have done a lot of research, and we look for solutions to problems, not just, hey, how are you? Here's your test. Here's your results. Bye. We'll see you later. We like to spend time with our people and show them what it is that we have to offer. And more than what we have to offer, answering questions and providing value to our patients. Okay? Hope that helped.